Bismillahirrahmanirrahim. Today we are going to talk on autonomic nervous system. I'm Dr. Bux Kachiwal, Professor and Chairman, Department of Physiology and Biochemistry, Sindh Agriculture University, Tandojam. Autonomic nervous system having a division of a peripheral nervous system, and autonomic nervous system is also known as a visceral nervous system or control involuntary system. Subdivisions of a autonomous nervous system: the sympathetic nervous system, which releases the epinephrine and norepinephrine; the parasympathetic nervous system, which releases the acetylcholine. Both work against each other to balance the internal environment. The nervous system is divided into a peripheral nervous system and a central nervous system. So the central nervous system is divided are based on a brain and a spinal cord, whereas the brain is divided into three components. Whereas the today, as we are talking about autonomous nervous system, having a somatic nervous system and then the peripheral nervous system. So autonomic nervous system is divided into sympathetic nervous system and parasympathetic nervous system. The sympathetic division that produces the acetylcholine in the presynaptic area, and then usually the norepinephrine at the postganglionic area. Whereas the parasympathetic system having a preganglionic release of a cholinergic neurotransmitter, and at a post-ganglionic area, it releases the acetylcholine. Sympathetic nervous system working in a flight and a fight situation. Major neurotransmitter is epinephrine and norepinephrine. The receptors are alpha and beta receptors. Whereas the alpha receptors, they are distributed in the smooth muscle, liver, and salivary glands. So the smooth muscle causing a contraction that will reduce the blood vessels, the eye, the bladder, the prostate, and the uterus. The alpha-1 receptors are distributed in these organs, whereas the alpha receptors effect on glycogenolysis, whereas the alpha-1 receptor on the salivary glands releases these secretions. Whereas the gastrointestinal smooth muscles, alpha receptors produce a relaxation rather than the contraction. So instead of a constriction, it relaxes the gastrointestinal smooth muscles. Whereas the alpha-2 receptors, they having a presynaptic neuron, they releases the norepinephrine or acetylcholine, whereas in the pancreas, alpha-2 receptors releases the insulin, whereas in the platelets, when alpha-2 receptor affects, that causes the platelet aggregation, and on the alpha-2 receptors, the central nervous system having a sympathetic discharge when the alpha-2 receptors affects. Beta-1 receptor affects on the kidney and releases the renin release, whereas the beta-1 receptor affects on the heart and that releases the rate, increases the rate, force, and automatically cardiac output. And the beta-1 receptors adipose tissue, that causes a lipolysis. Whereas the beta 3